Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And in this four-part series, we're going to discuss working with clients that have spinal issues, and specifically differentiating between disc-type issues and spinal stenosis-type issues. Because so many clients will present to you with chronic low back issues. And it can be hip issues as well. However, we'll just focus on the low back. They can have chronic tightness and or discomfort, and or the inability just to perform at the level they need to and or want to. And they present to you as a health and fitness professional to help them solve their chronic issues and move successfully towards accomplishing their health and fitness goals. So that's why we're so happy to have you join us here, and so glad that you stay part of our community so we can share this great information with you. And these are the same strategies that we use with our own clients and patients here in our clinic. Now, the reason why this is important is because when clients present to you with disc issues, you're going to train them and think about things a little bit differently than if they present to you with spinal stenosis. So I want to help you differentiate and learn some of the common signs and symptoms of each condition. Now, these are generalities. So as I'm discussing these concepts, it's very general, broad terms, because you can have clients that present with disc-type issues and actually have spinal stenosis, and you can have clients that have spinal stenosis and present with disc-type issues. So here's the common patterns, as common signs and symptoms you'll see in clients to help you differentiate between these two conditions. And remember, you're never diagnosing them, you're just observing them so that you can make an educated decision about what exercises to do and which exercises you may need to avoid. Your clients with disc issues generally are your younger individuals. So those are the clients that are more around, teens to their 30s, 40s, and maybe even into their 50s. These individuals with disc issues, they tend to have more problems with prolonged position, and especially flexion-based positions or flexion-biased positions. So what are flexion-biased positions? Obviously bending forward, obviously doing exercises like sit-ups, curl-ups, and leg lift type exercises. But one of the most common positions that is flexion biased or becomes flexion biased for the majority of our clients is sitting. And those are the clients that generally have more problems when they sit. And the longer they sit, the more issues they have. And especially as they stand up and try to go from the flex position to the more upright position. That's when they tend to have most of their issues. They will also tend to have more issues or complain more about, I get out of bed, my back is so stiff in the morning. Once I get moving, it actually feels a little bit better. Now, your clients with spinal stenosis, they generally tend to be your older clients. So we'll start around 50, 60, 70 and up. But again, it's all relative to your clients, more, not so much their chronological age, but just more how healthy their age is, meaning like how healthy their spine and their movement habits and strategies are, which we'll discuss in a moment. These clients tend to present more in that sort of curved posture, where they're very tucked into posterior pelvic tilt and spinal flexion. Because what they're trying to do, spinal stenosis basically means if you have an opening that should be this big, and now the opening is more like this big, now you have what's called spinal stenosis. It's narrowing of an opening. So it can be the narrowing where the spinal cord is going down the spinal canal in between the vertebrae, or it can be the neural canals where the nerves are coming out from the spinal cord and then going out to our neck, our torso, and or down our legs. So you have stenosis of either opening. And again, those clients are in that flex-based position, so they're very tucked under, they're very flexed through their lumbar spine and even into their thoracic spine, because they're trying to create more space, more opening of those areas where the spinal cord and our nerves are coming out. Now, generally, those are some of the common signs and symptoms. Now, those clients with disc issues, they will generally respond pretty well to extension type positions, okay? Spinal stenosis, you don't want to put them into extension because that's what starts to close down the canals and creates more of their symptoms. Because these clients that present with disc issues, they can have localized low back pain, and if it's hitting a nerve, then they'll have pain shooting down their leg or referring down their leg, and or numbness and even weakness. Spinal stenosis, very similar. They can have issues locally in their low back, but they can also have symptoms shooting down their leg. Generally, disc type problems tend to be more on one side, but it can be bilateral, but generally more on one side. Spinal stenosis tend to be more bilateral, but again, they can also be on one side because they can have stenosis just on one of those nerve canals and not the other side. So those are the common signs and symptoms and the common postures. As I mentioned, disc type issues generally respond better to extension type exercises. So things like the McKenzie position. Dr. McKenzie came up with that extension type protocol for disc type issues. They like positions like cobra or lying on their elbows, generally speaking. Clients with stenosis, you don't want to put them into spinal extended type of positions. You want to keep these individuals in more lengthened type positions. Not necessarily create more flexion because they're already biased into flexion, but create more lengthening type strategies. So things like where they're lying on their back, supported with their legs up, are generally good positions. These individuals will also, with spinal stenosis, will also prefer not standing. And that's why they will tend to, if they're shopping, they'll lean on their shopping cart, or if they're standing too long at a party or walking too long, they'll want to sit down to get back into a more flex type position. These individuals, like I said, don't flex them more, don't start introducing flexion-based exercises to them because they don't need to be more flexed, they need to be more elongated. So that really comes down to our last point. And our last point is, regardless of your client presenting with disc issues and or spinal stenosis, you want to help them create a more optimal strategy. And that's essentially what we're sharing with you in all these series of Integrative Movement Insider. It's not about exercises, it's not about muscles, even when we talk about psoas and glutes or transverse abdominis or the pelvic floor. We're not talking, even though we're talking muscles, we mentioned muscles, we're really talking about how do you help your client create their most optimal and their most efficient strategy for posture and movement. And we use the integrative movement system, the ABCs, alignment, breathing, and control, to help our clients create their most optimal strategy, whether they're dealing with a disc issue and or they're dealing with spinal stenosis. Because we believe that when you help your client better align, so put their body in a better position, when you help them create three-dimensional breathing, so they're regulating pressure and creating stability as well as mobility of their trunk, spine, pelvis, and hip complex, and when you teach them a better control strategy so they're not just gripping and or they're not just kind of hanging out and being loosey-goosey on their posture, you're helping them develop their most optimal and most efficient posture and movement strategy so they can ultimately reduce chronic tightness, even some chronic discomfort, and move successfully towards accomplishing their health and fitness goals. And that's essentially what we teach as part of the Integrative Corrective Exercise Instructor Program, which we're doing this coming weekend in Orlando, Florida, and also as part of the Integrative Movement Specialist Certification Program, which we start a brand new program starting this September. And that's what we're sharing with you in this series of Integrative Movement Insider. Because when you use a principle-based approach, you help give your clients a strategy for success that's based upon the principles that govern optimal and efficient posture and movement. So this is Dr. Evan Osa with the Institute for Integrative Health and Fitness Education, part one of a 4-part series, sharing with you the difference between clients that have disc problems and spinal stenosis. Now, in part two, I'll be coming to you live from Orlando, Florida on Friday as we begin our day 1 of 3 of the Integrative Corrective Exercise Instructor Program, where day 1 is all about training individuals with osteoarthritis as well as spinal conditions like disc issues and spinal stenosis. I'll share with you the most common corrective exercise pattern whether your client has disc problems and or spinal stenosis, because remember, the goal is to help your clients create their most optimal and their most efficient strategy. So make it a great week, and we'll see you later this week at Integrative Movement Insider. Take care.